Heard It Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Heard It Health. I'm Katie Adams, a reporter with MedCity News, and I'm here with Siva Namasivayam, who is the CEO of Cohere Health, which is a company that provides technology to streamline the prior authorization process. So prior authorization can be a pretty contentious subject. It's often criticized for taking too long, creating delays in patient care. And you've said that part of this problem is that, providers and health plans are managing this process as a transaction. So can you talk about why prior authorization shouldn't be treated like this simple transaction?
Yeah. See, when you really look at a patient, right, from a patient perspective, when they say there is a knee pain, it's not a particular transaction, right? It's usually you want to do the diagnosis first, and then based on the diagnosis, you might have 2 or 3 paths, right? It could be a PT, or it could be a pain medicine, or it could be a surgery. So when you really look at a patient, right, it's a journey for them whenever they go through a particular process, whether it is diabetes or whether it is any of the things, right? So they don't look at it as an individual transaction, right? So, but from a health plan perspective, because of the fee-for-service world that we are living in, every transaction is considered, because you first go and do a diagnosis with primary care. They might just send you to a radiologist who might take an image, and then they will say, okay, it's a transaction. They will send it to you. And then they go to ortho surgeon, and then they might look at it, oh, you need to go to PT, and they go to PT. So each one of it is treated as a transaction. But if you look at it from a patient perspective, they have a pain, they need to get it resolved. So it's like episode, it's a care journey. But health plans and providers have been used to treating it as a single transaction, which is not very effective. That's because once you know your patient has a pain, what are the 4 things that they need to do and who do they go to? If that can be determined ahead of time, then why go through 4 prior transactions? Why 4 prior authorizations? Why there is a care delay, etc.? So that's what we are trying to solve, is that, you have a patient, they have a problem, it has been determined that they have, they have severe pain, maybe they need surgery. So instead of going through 8 prior authorizations, let's have 1 transaction, get every step of the way done without any issues with respect to care delays, where they are going to go, etc.
That makes a lot of sense. I want to talk more about the technology that's involved in the prior authorization process. Why do you think AI and advanced analytic tools need to be used to automate the decision-making at every step of the way during this process?
Yeah. That's because when you really look at the process end-to-end, almost of the 100 transactions, say, prior authorizations, almost 80% of them get decisioned the right way anyway, at the end of the day. So why waste all your time on these 80% of the transactions that is the right thing to do? So what we do is that we use AI and advanced analytics and data to say that, is the patient there for the right, at the right provider, physician? Is the physician, based on the conditions of the patient, doing the right thing? They are ordering the right service. If they are doing it, why waste time? So what we do is we immediately decision. So by the time the patient gets from the back door where they get examined and they come to the front door, we can authorize the entire transaction so they can look at the next steps, right? So that's where AI and all the advanced stuff, that really helps. The second thing is that healthcare is all around today still faxes and various clinical notes that that they type it up and things like that, right? And there is invaluable information in that particular note that cannot be captured in the information that is put by the nursing staff to really get a prior transaction. So what we try to do is that we try to use AI to really read the note, find out, okay, what are the keywords? Is the patient having, say, are they a smoker? Do they have, are they overweight? So we can determine all of that information by looking at the note, but that's where AI comes in. And we can say that, this patient seems to have a condition, so just go ahead and approve it. right? So that's where AI and advanced technologies are used really. So on top of it, we are also trying to be able to predict when, hey, here is a patient with these conditions, and where are they going to be, what are they going to be doing 3 months, 6 months from now? Where are they going to show up? If somebody has got a pain, we know that if it is really acute, in 6 months they are going to need surgery. So we can predict where they are going to be, and that information is highly invaluable for health plans as well as for the physicians to be able to do that. So we provide that also.
Certainly a lot of different technology tools at play there, yeah. So before we end our conversation, I want to talk about value-based care. I know Cohere has partnered with health systems like Geisinger to help them reduce the administrative burden associated with adopting these new types of alternative payment models. So can you talk about why efficient prior authorization management is especially important when it comes to these alternative payment models?
Yeah, so value-based care is all about reducing the administrative cost and making sure that the patient gets very high quality treatment and the outcomes are really good, right? Mm-hmm. So now if you go back and look at my first statement, which is around why instead of considering prior authorization as a series of small transactions, why don't we consider the entire thing to be one episode so that when they show up, delays can be eliminated, and the entire episode can be authorized, and the provider can really focus on doing the right thing in the most efficient way. So do it in the right place, what is the right treatment, and do it with high quality, all in a very short period of time. And that's exactly what we do, and that's what health systems are really looking for. Because previously there was delay, stop and go. But now they say that, okay, the patient is coming in, the health system is taking a risk. They want to know, okay, what is the most efficient care path to be able to deliver the thing, and where all they should go, and what are unnecessary services and what are the necessary services. And we do that entire analytics, and we actually provide that information for them.
Excellent. Yeah, I see how that goes hand in hand. All right, well, thank you so much for your time, Siva. I hope you enjoy the rest of health.
Okay, wonderful. Thank you very much.